For the presentation. Our next speaker is Dr. Rodric Rhodes, and Dr. Rhodes is unusual because he has not only a license in clinical psych, but also in social work. And also he's an outstanding typing facilitator. So he's created this whole practice of, with a lot of kids on the spectrum, but many of whom are nonverbal and use augmentative communication. So he brings a very special expertise and has been instrumental for many families in shepherding them through those really difficult transition years through adolescence and young adulthood, when emotional dysregulation and challenging behaviors is a paramount issue. And so we welcome Dr. Rhodes and look forward to your sharing your wisdom on how we can better use these kinds of techniques to help our children through these tough times.
Invited sometimes to talk to the groups of professionals and families and schools and sometimes in conferences. So thanks for inviting me. And I know some people in this room that are very kind and I would say cool, people. And like I said earlier, I'm honored, to be considered as someone to come talk to all of you. It was an interesting invitation to come talk to you because the topic is on DIR and Floortime work. If people ask me, Dr. Rhodes or Rod, how do you work with people? I would say I work with individuals, I work with families, I work with couples. I provide consultation to people. The model is guiding, your work with people. I would say things like humanistic psychology, some interventions related to cognitive and behavioral therapy with a major overlap and overarch of that humanism being presented, so that what was shared at the very end of the presentation, that honoring of Dr. Davis in her work, is that unconditional positive regard and interacting with people in such a respectful way, being curious about what people's experience are, listening as much as possible. I'm sharing with you in this kind of didactic format, but my work is listening a lot, even to people who are not talking, but really trying to hear what people are sharing, with us through their movement, through their behavior, and through their, speaking voice, but also through communication and other means, like what was shared earlier. I do a lot of work with people who use augmentative communication systems, to communicate. I started down this path. Why am I sharing with you tonight, and how did I get into the role of being a psychologist? I grew up in a family of psychologists. My parents are both educational psychologists and worked in school systems their entire career. I was influenced by them heavily. But I rebelled, against my parents, who were both educational psychologists. And when I went into university, I followed in this modeling of my uncle. I wanted to do something different than what my parents were doing, kind of my own individuation, differentiation process and growing, and separating and, exploring things different than my family. I get 3 years into this business program, undergraduate degree in business. I get 3 years into that program and find that a friend of mine started working for a school district. And some of the people we worked with were people with autism. And so in that sharing that he and I would do, he would share about how meaningful the work that he was doing was. How he would get done working at the school district and how he'd feel very, very warm, positive feelings about what he was doing, how he was contributing, to these individuals, to the school system, to their families, and to our community. So I started, considering that sounds good. You know, that sounds really good. And I started opening up my own mind to why my parents were doing what they were doing and how they became who they were in their professional life. So I said, well, how do I do that? How do I do some of that? You know, and so he pointed me in the direction he was doing some work in the school district, and then he started working for an agency, actually up in this kind of region called Choices, that provides supported living services, you know, to adults with developmental disabilities. And they had been doing so since the late 80s. One of the first supported living, true philosophically based supported living service providers in the state of California. Their philosophy being that anybody, regardless of the severity of their disability, has a right to live in their own home, a home of their choosing. You know, and so it could be their own apartment or home, and it could be living with their families, it could be living with a partner, and they would provide support, whatever support was needed, funded through the regional center primarily, but also combining and getting creative with funding like through IHSS services and some other, you know, creative funding options to provide support to people, you know, who live in a place of their choosing. So they're supporting people who lived with their families for many years, and then family and the person wanted to move into their own place. They supported people who were living in state developmental centers and were moving into community settings, people that lived in larger congregate care settings, group homes, and other settings. And then they would provide whatever support was necessary. So that meant some people they would support, you know, for a handful of hours a week if the person felt comfortable and was safe living on their own and not having a lot of direct support. And they would provide support 24/7 to someone who needed, you know, support, not only with their health, safety, you know, life skills, supports, but also if they needed help with things like communication, and you kind of interacting and sort of facilitating their experience in the community. So I started working for that agency in 1992, and one of the first people that I met professionally that had autism happened to be one of the first people that was a typing person in the state of California, where Rosemary Crossley and some of the folks in Australia were bringing some of this learning to people, speech and language people that I know, and educators, and trying to help people to know that, you know, autism and other developmental disabilities have this motor skill planning, motor coordination, you know, aspect, and that was complicating a lot of their speech and language and communication. And so anyway, you may have heard of Sue Rubin, who's someone in the Whittier area. There's documentaries about her. But this gentleman, he was in the same school district that Sue was attending. He's older than Sue, so Sue is starting to get that kind of support to learn about that communication earlier in her school career. But this gentleman was already in the transition program. So in that, like, post-high school and figuring out kind of what the next steps were going to be, you know, after he graduated sort of from the school district at 22. That person then went on to, you know, move into his own home, and he's still supported, you know, in the community. And I got to spend a lot of intimate time with this gentleman, and he taught me. I attribute him as being my early exposure, in addition to his family, to my early exposure to autism spectrum disorders and what I know and how I conceptualize that experience, and it's influenced greatly my work with people going forward from that day. So I should have gone into psychology or social work. You know, I'm 3 years into this program. I need to get out of business and into human services. So I changed my degree from accounting into human resources management. So I was thinking, so I started learning about Maslow and some of these early psychologists in my business school, you know, and so I graduated with a business degree because I was so far along. And then my plan was for certain was to go to graduate school. So I kept working for Choices, and then I went to Cal State Long Beach in social work and got a degree in social work, and then got licensed in social work. And then that enabled me to start doing things clinically. So I had a license and some letters after my name, and I could work with insurance, and I could, be a consultant to school districts, and I could do some evaluation kind of work, but also work with people clinically. And so I started doing that, and I, started working for a children's agency and became like their, kind of, autism specialist, consulting with people who are in the mental health system that also have a diagnosis of autism. If there's a question, whether it was anxiety or obsessive compulsivity or social phobia or ADHD with a bunch of social interaction issues, they would come to me and we would brainstorm and figure out, what other assessment might be needed and how to connect them to different resources. Support kind of manner and helping to, helping people to live in their own homes, and then also helping with other things. So like, the whole philosophy of supported living, if it's done purely, it's asking questions about what do you want your life to be like? What family members are you wanting for your son or daughter? What do you want to be doing, after you complete, your formal education? What are the next steps? What help do you need to do those kinds of things? And so asking a lot of those questions, and then brainstorming together to figure out how to support individuals and families with what those next steps, are, and providing whatever support's necessary to access, those goals that the individual defines and the family defines. So I went on in that road, and then I started going into private practice, and most of my referrals within private practice were children, adolescents, and families across all mental health presentations. And so it could be adjustment to a divorce in the family, it could be some major life change that was affecting the family, it could be some adjustment to some other health condition. And then a couple of subspecialty kind of areas that I started getting tons of referrals in was this autism, kind of area, and also some other neurodevelopmental issues. So it could be other developmental disabilities, but also a lot of ADHD, kind of what was coming my direction. And so I started working with people in my office, with those diagnoses. Within the autism community, the themes that I was seeing mostly were individuals that had that were trying to figure out what the next steps were, in their life. And so what Joyce was sharing about transition from sort of adolescence into adulthood, because of the experience and kind of social work training in helping people with implementing support systems across the community and in housing and social skill development and adaptive skills and employment and school, post-high school services to access help to attend college or getting some vocational training. That's kind of what we'd be working on together, with the individual that has the diagnosis of autism being at the center of figuring out, what those next steps are. So I do, if someone comes to me and they say, and we're having a hard time sort of figuring out, what their communication system is, I'll refer people over to like a speech and language person that's familiar with augmentative communication and speech and language. If they don't yet have more of a verbal or a typing communication system, I will support families in brainstorming, but I have like the sample of people that I'm working with are, if they've come to my office, either I will link them, with an agency like Dr. Davis's agency, or connecting in with more intensive kind of services, or connecting to speech and language, intervention to look at the communication piece. Because really, I would say the majority of people who are not talking using their oral voice are people that are typing, that I'm working with, and so I'm supporting people and their families in that manner. I'm really grateful for agencies like Dr. Davis's, and there's more, you know, Floortime kind of providers that are out there. And I've done work with individuals that are connected to Eastern Los Angeles Regional Center. I have 2 offices, one's in Whittier, and so that's in that East LA Regional Center catchment area. I've been really happy, probably with work and advocacy by people like Dr. Davis and other people in her network, to get Floortime as an option, you know, in addition to the other historical, you know, ways of intervening, and was only allowed, you know, for intensive intervention. I did, though, prior to some of this maybe laws passing and, you know, and things changing, I thankfully had BCBAs and behavioralist people that were flexible in their thinking, who also had experience in Floortime and DIR work and started looking at other systems of helping people, and really, you know, looking at a person from looking at their sensory needs and their communication, you know, needs and methods, and looking at the connection between the individual and the family, the interactions between the person and others, having deep respect for the competency of the person and interacting with the person with curiosity about, you know, what are they wanting to share with us, and how can we work together, you know, to keep growing and working on the goals that they're defining, you know, for themselves. So thankfully, you know, more intensive supports are available, and I really appreciate what Dr. Davis was sharing earlier in modeling, is that there are intensive services available, and I appreciate the systematic, you know, perspective, you know, developmental perspective. I would say that, you know, again, the area that I'm going to be speaking to more is individuals who are letting us know, you know, through their behavior, everyone, and through their, you know, typing and other communication methods, in everyone, I would also propose, but the difference being that it becomes easier for me as the listener, you know, to get direct feedback from the individual guiding my work, you know, with them, and us to collaborate more, you know, when there's a communication method I can, in my being attuned, I can guess and I can sense, you know, what someone's wanting and needing, and what they're wanting to tell me or other people, you know, that they're in interaction with. But it becomes, and families, for certain, all the families that I've met with know more, you know, about what might be being shared, you know, by their child, or, you know, even an adult child. And so I'll collaborate with families a lot when we're trying to get a sense, you know, of what the person's wanting us to know. And then it becomes just easier, you know, when there's real clear typed and verbal communication that's letting us know, you know, through you know, of different things that they want to share, you know, with us and with the people that they're interacting with. Wanted to share with you some different experiences I've had with people, you know, that I've worked with, and I might be maybe changing the gender, and maybe changing the age, and maybe changing where they live, and, you know, things like that. But I had this experience earlier today of a young man who did graduate from high school about a year ago, and very capable, you know, academically, particularly in the verbal, you know, kind of realm, and so he would excel in English and, you know, language arts, and had a high vocabulary. Struggled in some of the, you know, some more symbolic mathematics kind of concepts, and so this individual had a lot of challenges with behavior and trying to connect with people, and having lots of challenges, you know, with that. And so if he found someone that he clicked with related to, comics or superheroes or Transformers, was, had these really quality, I would even call it more reciprocal interaction. But when it came to interacting with people for the first time that didn't share those interests, or that he was having a real hard time, kind of introducing himself to, he would get real defensive, anxious, stressed out, and then become combative. And so it would lead to, verbal aggressiveness and sometimes physical altercations at school. So this individual, we got some thoughtful, one-to-one support, and this was a person that was getting, really high grades, really, in some of the subjects, but really needed someone to be sort of supporting him to stay kind of calm and regulated, and then to try to coach him through some of these social interactions if he was interacting with people that he wasn't really close to. So I've worked with him for a number of years, and we got these other supports in place at school that were helpful. And then it came to graduate, and then those school supports weren't there anymore. And so we've been in this process of trying to figure out what the next steps are. And unfortunately, the regional center that we're interacting with is not as flexible and open-minded as some regional centers in this area. And so we've been trying to help the regional center understand him more and understand what he's needing more. And so just today we had this meeting with the regional center counselor and myself and with a parent, and we did some discussion about what kinds of things he might want to share with the regional center counselor. It's an amazing job at letting the regional center counselor know that these particular programs that they were referring to, which were kind of classic day program kind of services, this is an individual that, with, I think, real sophisticated support, will be able to, work in a place of his enjoyment and would be a really quality employee. The regional center was thinking that because of his background of behavioral challenges that he needs to, join like a traditional workshop, structured day program. And I would be advocating that many people that are attending those programs just aren't aware or aren't able to self-advocate and may not have families that are networking and connecting to groups like this. And so they may not know what all the options are.
What were the supports that he had in school and you were advocating for outside of school? What were those supports?
The supports in the school were this particular district, because they were doing a lot of funding of BCBA, ABA kind of providers outside of the district. This district brought some of those supports in the district, and so it started like an in-house ABA, behavioral kind of program. But with some of my guidance and coaching and knowing some of the supervisors in that program, we were able to influence that sort of traditional behavioralism only. It wasn't effective, for this individual. And not only was it not effective, it would be harmful. It led to increasing stress and anxiety, increasing behaviors that would warrant a higher level of like more restriction in the school environment, exiting him from that general education high school and moving into a non-public environment. And so, big, shift. But with that one-to-one support, and then us being able to collaborate a little bit, and them being receptive to kind of, to be considerate of what he's letting us know, through, his preferences and what works for him and what doesn't work for him and things like that, then they were able to, work with that. So that actually came up in the discussion today, because we were talking about what supports do you feel like you would need, in these next steps to help the regional center kind of get on board with some of these more creative, individualized supports. And he was able to articulate that I need to be respected I want people to be nice to me. I need people to listen to what I'm telling them. And then Mom got a little defensive and said, well, you need to also you need to be open to what other people's feedback is. And he responded with, I know that. You don't think I know the difference between being open to feedback and being punished?
Wow.
You know? So this is an individual that would say very few words, you know, to people, especially if he didn't know them. He was able to draw back on some of the people that had a kind of a more behavioral, rigid approach, but became more flexible with some coaching. And he referenced, he said, like that one aide that I have,
wow,
and like this other aide that I have, not like this aide and this aide and this aide that were being more rigid and punitive in their approach. So it helped to, so I share that one from the, you know, the shifting that can happen through, you know, again, the principles that Dr. Greenspan, you know, outlined and Dr. Davis so eloquently described in more detail. And so and then the regional center counselor shared, this is a regional center counselor that hasn't been real open to listening in the previous interactions. And so the regional center counselor responded with, this is so helpful for you to share this with me. Because we've heard from Dr. Rhodes, you know, being an advocate, we've heard from your mom, we've heard from, you know, advocates who are like helping to represent you, but this is so helpful to hear directly from you. And so I would have appreciated the regional center counselor earlier in the process to be respectful of what parents were sharing and what Dr. Rhodes was sharing too. But it really was beautiful to see this kind of being more open, you know, to this, to hearing, and for him to be advocating, you know, one aware, you know, self-aware, but then advocating for himself with some support. You know, we were providing some support, you know, in the process.
Without that kind of therapeutic intervention from you and from the other individuals, he would have never been able to individuate and be able to even have the understanding of closeness or respect and know the difference between ABA is not a bad thing, it's Pavlov's dog to me, and it's not what you're talking about. So without that, I don't think, do you think he would have been able to articulate what he articulated?
I don't believe so. Yeah, I believe that, and I believe that I was one of the people in his life, you know, but we've done lots of family work, a lot of time spent with Mom and him and me together and other family members involved for years. And I don't think it would have been as successful just me working with him individually. So that's where that intensive intervention component comes into play, and I would really love more examples. There are some examples I have of DIR Floortime providers being the non-public agency providing the one-to-one support within schools. But they're few, you know, yeah, and I would like that to change, you know, so not only regional center systems, insurance systems, but also school district systems becoming more comfortable, like, because their kind of go-to, you know, if they need a non-public aid support, their go-to is to bring in, you know, behavioral, you know, providers. But I really, and like I said, I know some behavioral providers that are credentialed and have that skill set, but also see things in a more holistic, you know, more flexible, you know, way, and are open to other, you know, kind of schools, you know, interacting not having such rigidity. And so I would like more of that option, because I think that my observations of DIR floor time providers working individually with individuals that I work with, I think the respect, the listening, the heart that was shared earlier, that just seems to be more a part of the philosophy, of DIR floor time providers. So if you asked me, and I think why I was invited to participate in this maybe, is that the way that I work with people and interact with people is I see parallels between myself and DIR, kind of DIR trained and kind of a strong association with that model, and I love the option, to be able to work with people in a more comprehensive throughout the day into the evenings and have that more integrated, families and other providers. And so I would love, to be, so when I'm thinking of, I spend 1 hour mostly, 1 hour. Sometimes if there's more urgency and intensity in what's going on, I'll meet with people for 2 hours a week. So I'm kind of like a traditional psychotherapist in that way, and I see, a bunch of people and families each week. So to be able to go be a part of the home and connect with people in a more intimate manner, and the individual and families, I want to be able to connect people with DIR providers in more comprehensive, like the 30-hour a week and the 40-hour a week, kind of recommendations, but having the DIR philosophy being the guiding way of interacting. Because I think the more opportunities that individuals have to connect with and relate, to people, not only their immediate family, but other, professionals who are calm and regulated and enjoying their time spent together and are exploring their home and their community and their world, the more that can happen in a non-anxious kind of position, the better, and I appreciate the involvement, of like the village, the village it takes, is helpful.
How do you deal with individuals with challenging behaviors?
Great question. So so that's another major reason for referral, in my direction, is someone is trying to find, they get a recommendation from a pediatrician, developmental behavioral pediatrician, psychiatrist, neurologist, school district, to get some more help with something that's happening. And the family's at a loss, and the school district's at a loss. A lot of times the medical person wants someone to spend some more time assessing the situation and then helping, to figure out a plan. So someone comes to me and they say, let's give me an example of an intense behavior, a challenging behavior, the most challenging you can think of.
Biting?
Biting. Yeah. And they're biting themselves, they're biting other people. Okay. And so I'd be asking a lot of questions. So I'd be asking things like when is this happening? What are the circumstances when this usually happens? Are there identified stressors that are happening? Does it seem to be, from a defensive kind of anxious position, or like a self-protection kind of standpoint, like someone gets too close and they're so kind of nervous and stressed about that, that they let someone know to get away from me, or is it is it out of some other emotion like anger or or sadness that then emerges as anger. You know, and so looking at those kinds of things, is there some kind of sensory, you know, feedback kind of system? I know that some individuals have shared with me, you know, again, I've learned some of this through people typing, but that when they're biting their own hand, it gives them something to focus on, so that they're not biting other people. They're much similar to how I, you know, with other teenagers that I work with that are doing some cutting, you know, kind of behavior, like an imparting like a pain kind of response, and then out of that pain response, there's neurochemicals that are being released that are calming. So almost like their own initiation of a calming medicine, you know, that comes with, like, there's a kind of an intensity and then a, you know, like I can relax. With the biting of others, I would be asking those kinds of questions, like how does this serve you? You know, what is the purpose, you know, behind what you're doing? Can we learn more about that? And so, if they're typing individuals, I'd be asking them questions very directly about, you know, when is this happening? Why are you doing this? You know, how long have you been doing this? Are there certain people that you're more prone to do that with? And asking a lot of why questions. And then if we don't have that communication method formed yet, then we'd be trying to take some educated guesses. You know, some would be just my experience and research and reading but also my direct experience with people sharing with me about why they're doing this kind of thing. So, oh, I met someone else that, you know, this is why they explained this is why they were biting. Does that resonate? You know, so even if they don't have a more prolific communication system yet, you know, they can let us know sometimes by you know, verbal acknowledgement of support of that idea or not supporting, or yes and no, you know, and asking some questions that way. I would draw upon the family and people that are closest to the person to give their best guesses, and then we'd be kind of curious together and share with me, what's your best guess as to why this is happening? Is there certain times that this happens more than others? Are there circumstances going on within the individual or within the family dynamic or within the school dynamic that might be causing stress? But I would say all of that combined, usually I see that when the person's really stressed. That's what, if you said, when does that happen the most? When people are biting other people. I'm seeing that the person is really stressed, very anxious, and generally people have shared with me that they're wanting help. You know, with not only that, but maybe the other things that are causing an increase in the anxiety and stress and upset.
And what do you do with that? I mean, play that out. I mean, from there, you know, you're saying that it's communication. All behavior is communication. You're asking why from the heart. Then what do you do? Is that
putting, yeah, you know, then because I put a little bit of my social worker hat on and like sort of planning and like, okay, when does it most happen? Let's figure out some protections, you know, so that people aren't getting hurt, you know. Like, for example, there's an individual, I've worked with many individuals, but one individual that that kind of thing would happen mostly when we'd be going into a new situation. And if they're in a new situation, I would say new situation because it's a heightened stress circumstance, but it could be any kind of anxiety-provoking situation. And then we also are in a situation where there's other people, generally people that they don't know, but sometimes it can be the person that they do know, you know, that's very in close proximity to the person, and we're kind of going into this new situation or encountering some stressful circumstance. And so I'd be like the example I'm thinking of is I'm helping someone to go to a professional basketball game. We're seeing some signs of stress on the way to the basketball game. Parents set up this really cool, situation where the family has some resources through a trust, so they could use the trust for doing cool things, outside of the sort of the normal activities of daily living that Social Security would cover. So the family funded this trip in a limo, first time ever, in a limousine, going to a Staples Center. Stress on the way to the Staples Center, stressing out a lot of biting themselves, and some not biting yet, but lunging, kind of at me, because I was closest to the person. So we did some just reassurance, verbal reassurance, not a lot of typing in that point because the light was dim, and just saying, hey, we'll get through this. We've gotten through this many times before. I know that this transition and the traffic that we encountered was a stressor. We get into the parking lot, the madness of parking was a stressor. Even with this VIP kind of thing with the limo, stressful. We get out of the car, we get into line, a huge line, stressor. The person's a little less stressed, actually super stressed in the limo. We get out and kind of the new sensations and experience of the colder air, maybe. I don't know. I didn't ask him that question. But different variables I'm thinking, like being less crowded, before we got in line. So on the way from the limo to the line, things were calm. We get into line, stress starts to get higher, starts screaming, was starting to bolt, try to get back to the car, and I was saying, hey buddy, let's try to get through this, let's try to make it happen. I'm confident that we can get through this together. Once we get to the seats, things are going to be different. Once we get to the seats. So it's trying to reassure him along the way. He would start calming down a little bit, but then he would start getting ramped up. Once we got in line, and started to come, at me in a more aggressive way. At this point, security starts to get worried. The other people around us start to get stressed out. And this is a big guy, bigger. I'm thin, and I tell my 8-year-old son I'm weaker now, and so I'm not buff and strong. And this guy is big, but he trusts me enough to go to sort of roll with me, and I could kind of put my arm around him, but then I'm more in proximity, to getting bit or hit and things that can happen with him when he's super stressed. So put my arm around him. I try the hand that he would usually hit me with, I'm also kind of holding in hey buddy, we've got this together, like that, so the security comes over. They say, this did not look like things were in control, sort of seamless, and things were getting kind of intense, and I was saying, hey, I think we're going to be okay. We just need to get to the seats. My gamble is getting to the seats, and I'm pretty confident, knowing this gentleman, that we can do it. So they, instead of taking a defense, they were like, oh, okay, this guy seems reasonable. He's worked with a person. Things aren't as out of control as he was thinking that it looked like. So then the security paved the way. They said, let the man through. Immediately, the anxiety goes down, and then we get into sort of the lots of people in the sort of the corridor. But definitely, when let the man through, things went down. He felt heard. I'm letting you guys know I'm super freaked out. Help me out. And he was accepting, of that support, from the police people and me. We get crowded, starts to ramp up again. We had to wait to kind of get in, start ramping up, but didn't return to the biting. I can't recall. He may have started, trying to bite his own hand, which he has years of experience of that, and so I wasn't so concerned about him harming himself. He doesn't usually break the skin. There's calluses developed, from years of that kind of thing, and so okay, if that can be soothing, let's do that instead of my neck. But then we get to the more reassurance, more saying, hey, it's going to be cool. Let's try it out. If it's not, I think I shared we can leave. We get to the seats and we had a wonderful game. Wonderful game. Was able to stay the whole time, and and a lot of sensory stuff for him too. So crowded spaces. Hot temperature is a big thing. So in our enclosed space in the limo, I think the cool temperature outside was helpful. But then started, with close proximity to people, started getting anxious, space proximity, and then, and he's a bright guy. He's a typing individual who lets us know, his awareness that he'll say things like there's just so many unpredictable variables, and when I wasn't a big, basketball kind of attendee, and so I didn't have as much coaching or informing beforehand of this is kind of what I'm thinking it's going to be like, what do you want to do about those things, how do you want me to help you? But you're kind of like, I think a lot of times with parents, there can when there's, and that was the individual that I started working with in 1992. And so I knew him for a lot of years. So much the reassurance that a father or mother can bring to the picture and understand and help to articulate to the police officer, hey, things are going to be cool, we're going to, but let you know, this is what's going on. I had a really close relationship with him. I saw a hand over here, and then can I come back to you?
Sure.
Yeah.
Yeah, I was just, as you were talking about how this particular individual, had a hard time because all these things that was expecting, like limo and everything, and I was just wondering, because we did Floortime with Dr. Davis years ago, and one of the things like social stories, like kind of telling them, even though you're dealing with an adult, but just typing or talking like, hey, this is what we're going to do, so that they know what's coming, and sort of, even though you can't change things, but so that they're aware that, oh, this is like going to be a bumpy part. This is a bumpy part, and that maybe that is that something that you would suggest that would help?
Yeah, absolutely. And now that I know that experience more intimately, but it was my first time, coming to a game, to a professional basketball game. That was my first time too, and so I would have liked to have more ability to say that. We did talk about saying it's going to be a drive. There's going to be traffic, and I didn't know the level of traffic once kind of exiting the freeway, to get to the game. That part. So that was a big bump, and then the whole procedure of how busy the parking lot is and how busy. I just have more experience going to professional games now. So yes, absolutely. In the social skills, social story format, or just talking. This is my experience, and this is what I'm anticipating, kind of encountering. How would you feel about that? What if that happens? How do you want to be helped? During that.
The loudness was okay.
Huh?
The loudness was okay.
Yeah, interesting. That again. I think it's these examples of flexibility, that can be enhanced, through practice. There's absolutely sound sensitivity to this guy. This is like one of the guys that would, be covering their ears when they would hear bells ring in school and thunder. We don't get much thunder these days. Thunder, clapping. He was really receptive, to the sound. I kind of he did actually share, as you're reminding me, he did actually share that, because I was surprised, how come the noise didn't, you know, affect you so profoundly? And he said it was so loud that it was so consistently loud that I was that I was actually reassured, because if I started screaming, I wouldn't be heard. I would blend in. So he shared something like that, and then and then also the consistency of the loud noise was such that it was almost like an adaptation to constancy, you know. And so lots of people I know, if they can just get through the initial, you know, panic, you know, and with people that I work with that have panic conditions, you know, if you can sort of that exposure, you know, kind of experience of, if I can just make it through the panic, the episode, the stimulus that's causing the panic, and not die, I'm alive, you know, I'm okay, and like this experience is different than I was anticipating, and then such relief that I'm alive, that I survived. And so I wonder if that played a little bit into the, you know, kind of becoming, you know, almost like overloaded and then immune, you know, like a stress response, a normal stress response of adaptation to a stressful circumstance. Hopefully not traumatically so that the enjoyment of that experience overall, and his feeling so proud of himself for surviving through the experience. And he was reflecting and saying, sorry, I tried to bite your neck, you know, and you were getting hit, and, you know, and all of that kind of thing. Yeah.
Now, I just wanted to add one more thing. I think probably why it sounds like it really works is because, like, Dr. Davis is like a humanist, and with like the first example that you gave, you know, I want to be respected, that feels respected, that you're kind of following his lead, like what is it that you need right now, and that he's being validated that, yeah, this is a stressful time for you right now, but that we're going to get through it. You know, that exact encouragement is, I mean, who doesn't want to feel respected? So instead of like the rigidity of sometimes of ABA, where if there is no flexibility, because sometimes you need that, the ABA, but you need that connection, with a personal connection as well.
What I think, before I come to your question real quick, what I have found is that, and I don't know if you all have seen this, but I've seen more and more ABA providers starting to talk about rapport, you know, and really traditional, you know, kind of the popular ABA providers that have been around forever, starting with the emphasis on rapport. Now, then the importance is, you know, continuing that relationship and connection. Then even, you know, some of the behavioral approaches, if they're thoughtful and I would say for the older individual, you know, bought into, you know, like the person guiding, like I really need some help with this particular behavior, and could we practice it, you know, in a more, you know, that could be challenging, you know, like let's experiment, you know, with this new thing, or like I've worked with. Okay, let me come to this person's question, and I'll share an example of that in just a moment.
Let's say in a scenario where you do the prep, you know, I create a story on pigtail level. We talk about it. We talk about the variables of what could occur on the way to the game, at the game. Okay. You do all that prep work, you get there, and then you encounter the security. Let's say they were not flexible. What would have been your approach at that point?
I would have tried, you know, the security, I think I interchanged, you know, security and police. In this circumstance, they were security people. And so I probably in that circumstance, I wouldn't have been as stressed, and I would have been more, you know, confident in saying, hey, look, this person has an autism spectrum disorder, they're really stressed out, they're anxious, they look out of control, but really, you know, I've got it. You know, I've got it covered. If I'm getting nervous that I'm not safe or other people aren't safe, then we will go somewhere different.
So would you
Yeah.
encourage a parent to say that?
Yes. Yeah.
So,
Yeah. If the parents.
I'm at
Yeah.
Trader Joe's and my child is screaming and biting herself and people are recoiling in fear, I say, this person has an autism spectrum disorder.
If it's, yeah, I'd want to exchange with your daughter a little bit and say, is it okay to educate people? You know, and if we did educate people around us, you know, how would you want that to go? You know, what would you want me to say, you know, in that situation, and try to learn, you know, more about it, you know, so it's like more collaborative. So,
Yeah.
because
But
some
not
people,
in that moment. You have
yeah,
to discuss
exactly,
that.
yeah, discuss it ahead of time, right? Later,
Or ahead of time.
yeah.
Before
Yeah.
going to Trader Joe's the
Yeah.
next time.
Yeah, exactly, yeah, so it would be hard, you know, especially when the person's really stressed out, you know, to have a discussion like that.
Right.
But yeah, but I think helping people to understand, because what it does is it helps us to connect, you know, with other people, and that helps our interaction, and it generally helps anxiety to go down collectively. It helps our own anxiety to go down because I'm sort of declaring what I am observing happening, but it also helps the system anxiety to go down and go, oh, all right, oh, that person isn't hot, like some of the adults I've worked with, this is an actual situation. That person isn't high on methamphetamines and trying to attack the bystander on the sidewalk outside of my office. That person has an autism spectrum disorder, got super stressed out in my office, was about to start, you know, breaking tables and things. We were helping the person to get out to the car where they were calmer generally. But on the way to the car, they threw down on the ground, and the support person, who is a strong guy, couldn't like, hey buddy, we need to get to the car. You get to the car. Let's get to the car. It's safe in the car. You know, it's safe right here also. But there's going to be other people like the police, you know, responding. And so yeah. So then so it helps even the police sometimes to say, hey, person has an autism spectrum disorder. This is what's going on. This person's super stressed out. I've got it pretty well managed, but it's just going to take a little bit of time. You know, we've got it. Or if we don't know, if we do need help, then we can say, hey, can you help me?
Right.
Can you pave the way? Can you help us to get out to the car as quickly as possible?
And another thing I heard you say, it sounds as if with this gentleman's aggression or self-injury, it sounds as if this is something that you accept, and you're not necessarily, you know, trying to eliminate this behavior, because you're like, oh well, he's got experience with it, and the calluses and things. So in your practice, this is something that you accept as, you know, this person's experience.
It's a little. It can sort of. I want to help the person to not do behaviors that are harming himself and potential for harming other people. And I find that when I approach things from a stance of let's figure out why this might be happening and what's the purpose of this and what are you letting us know about what's going on and how can we help you, and being interested in what the person's sharing, treating the person with respect and non-judgment and kindness, and watching out for my own anxiety climbing, you know, when that's happening, and preserving that close relationship, that I find that then those behaviors go down significantly, if not behaviors eliminated.
Because we're entering a new terrain. My daughter's 12 and a half, and we're entering a new terrain of floor time. And this is what I'm really enjoying learning, is that she's going to be a collaborator in this process. Yeah.
Yeah. I was just going to share real quick, just to, yeah.
Just share that story and then
I just-
it'll be.
Open up for
if you
more
come
questions.
up- If you can come up to Dr. Rhodes, because we need to
Wrap it up.
wrap it up. Yeah.
So just a last question, or last scenario of an individual, also someone that has a lot of aggressiveness. He's a typing person, and I'm generally sitting next to him while we're working, you know, together. And this person gets into stuck patterns. And so one of the stuck patterns is actually at the carriage return time of like he's using an Alpha Smart. And so when he gets to the end of the line, he has to hit the on-off button 2 times. And then on the 3rd time, then he can put the space, and then he'll keep typing, you know, and it'll go to the next line. But if he doesn't do that, if I've tried to interrupt that without him being bought into that kind of idea, which I started to try to do, unfortunately, then I would get whacked, you know, and glasses would go flying, and you know, that kind of experience. So I then became more attuned to the fact that, okay, this is a stressful circumstance, and so even if he wants to work on curbing that or becoming a chance for working on flexibility possibly, I really need to inquire from him, you know, how can we approach this, you know, situation. So he gave feedback that it's okay to practice this. You know, so a little bit of like a behavioral, you know, kind of intervention of when I get to the end of the line, I want you to move away from me with the communication device. And how he responded was getting stressed. But he didn't hit me. And actually he didn't hit himself, he didn't bite his hand, he didn't hit anything, but I knew he was definitely stressed. So we started practicing, you know, trying to the best of his ability to take some deep breaths. If he was having a hard time regulating that, then I would start taking some deep breaths and sort of practicing some meditation myself near him, you know, like in the seat, like moving over there. He wouldn't jump up and try to get me, you know, but he would stay seated on the couch. And so, but over time, he became more flexible. And I did too. So he sort of, he will sometimes go to the next line. And then sometimes, and I'm curious about the themes, you know, I'm paying attention to that. And so sometimes he'll get to the, you know, to the end and he'll do that pattern. And I'll say, oh, that's interesting, you're doing the pattern right now. And he'll say, I know, sometimes it's just my thing, and we don't press it. But what I've also found is through an experiment like that, then he starts to demonstrate some increased flexibility with other situations too. So not just with the carriage return, but with the pattern that he uses sometimes when he's leaving my office. That he has to have the front door closed before you know, and we say goodbye. He walks out, and then he's waiting for me to close the door, and then that gives him this cue then to walk to the car. He moves out, and I kind of you know, switch it up a little bit, maybe with some of the same goals that was shared about earlier, and I'll kind of be playful, like I'll you know, like looking out of the door and saying, "See you later." I know I'm testing you a little bit right now, but and we'll have some fun, you know, with that, and he'll share. I know you're playing, you know, and so he's become more flexible in other situations too.
I just wanted to bring up to the gal over here that many of our police departments are becoming more aware of students and people on the autism spectrum. I know that Alhambra and Pasadena, probably St. Gabriel, have been trained. I'm sure Burbank, you know, Glendale. And the other thing is, years ago at one of the autism conferences, I picked up from Taka cards. They were just, you know, the little business cards that had taka.org, but you could make your own with your little person's name on it if you wanted to share that. But just that this student has autism, and if you want to know more about autism, look up autism.org or whatever it was. You know, now it's probably Autism Speaks. So that we are educating. You know, some of the behaviors are very scary looking, and yet it's just an explosion. I mean, how scary would we be if we expressed our emotions in public, right? So it's just a matter of educating the public that's not been aware, and you know, all of us are so involved and engaged in learning about autism every day that it's our responsibility to help them, you know, make the journey as well. So I would recommend, you know, just a little, you know, like a business-sized card. It just says, you know, my daughter is experiencing an autism you know, meltdown or whatever you want to call it. And, you know, if you want to know more about autism,
I know I know a particular psychologist that does a lot of training to law enforcement and has met with lots of agencies and has written, you know, manuals and has collaborated actually with, I've worked with some law enforcement families too, and some of those family members and parents have been able to educate their own departments, but also sometimes serve as like a professional consultant and collaborative presenter. So with a psychologist and a police officer and you know, fire department, you know, personnel, and they'll do, you know, I don't know if she's still doing some of that. I've heard that name. There's another person on the west side, you know, that does some of that work too. Actually, someone a psychologist that wrote a letter to the American Psychological Association in support of typing people. You know, when Americans, it's like lots of organizations are, you know, kind of critical, you know, of typing individuals, not as open to and receptive, you know, to that. And this is one of the psychologists that does this training that wrote a real pointed letter back to the American Psychological Association and shared, you know, her own experience with lots of people that type.
I need something for film. I need your full name and your information because we didn't have the screen. So
gotcha. And I'll also let you know I'm always interested in sharing my contact information and ways to reach me. And some flyers are in the back if you want to call me with questions, additional questions. But my name is Rodric, R-O-D-R-I-C, Rhodes, R-H-O-D-E-S. I'll give you my Whittier address, 7901 South Painter Avenue, Suite 3, Whittier, California, 90602. Phone number is 562-618-0451. An email address is rrhodes2@earthlink.net, rrhodes2@earthlink.net. If you send an email my direction, please follow up with a phone call too, because I get tons of emails, and I really do have a passion for helping, you know, people to get linked up, you know, to agencies like Dr. Davis's. So I have a passion for talking to people with not the goal of them coming to see me always, but trying to link people with medical people that I think are awesome.
Single case agreement.
I'll share about the single case agreements with doing kind of traditional counseling or psychotherapy, like 1 time per week kind of thing, or 2 times per week, an hour with a consultation with a psychologist or clinical social worker or MFT. Insurance companies are responsible for providing appropriate medical and psychological services for the people that are constituents of the insurance company. Because sometimes someone is needing a specialist in a particular condition or particular services, they will seek that out through the funding of an insurance company. When they are not able to secure that resource from the insurance company, still the insurance company has an obligation and a responsibility to provide those medically necessary services. So I've been successful in helping collaboratively advocate with insurance companies to get services with a specialist in autism spectrum disorders. It can apply to other mental health conditions as well, or with people that are typing people that I work with, finding a provider that can help with the supporting the augmentative communication system and work with the individual and the family in that unique way, with having appreciation for the communication method that they're using, as opposed to most of the providers that are out there would conclude that, okay, if the person can't talk verbally, then they're not able to or not allowed to participate with a therapist in a counseling kind of session. Once it's articulated to the decision makers and the clinical teams of the insurance companies that the person needs an augmentative communication system, and the family can support the therapist sometimes can support the communication, they can bring a communication partner to the session with them to participate in the session, but they need a therapist that's appreciative and knowledgeable about that methodology. So because of that, families can request a single case agreement, ask to talk to whoever the clinical decision-making team is at the insurance company. Some insurance companies, it's easier to get these done than others, but all of them have the same requirement to find medically necessary service providers that can help the family. And if they haven't been able to, then they're entitled to something called a single case agreement. Sometimes they call it an ad hoc arrangement. And those ad hoc arrangements or single case agreements can be formed in an agreement with the provider.
And
like
is that it, Dr. Davis?
Well, Dr. Davis, myself, any provider that they prefer to go to and are interested in going to that they think would meet the criteria for helping their child.
And how does that work with you? I mean, is that the same case, Andrea Davis?
We actually are contracted with a number of insurance companies already, so we don't require the single case agreement to work with us, either in a traditional psychotherapy mode or an intensive in-home therapy mode, which is a whole different benefit package. We're contracted that way as well, so it's not required.
So you're regional center and insurance?
Right.
Okay. All right.
And myself, and there's psychiatrists that you will come across, and neurologists that you'll come across, and developmental behavioral pediatricians you'll come across, and other psychologists that aren't in the network. And so sometimes people will present at conferences and they'll say, oh, we want to go see that person. And then when they start talking to the person, they say, well, we're not contracted with that particular insurance company. But I want you to know, audience, and also other providers to know that if they have specialization in these areas, they're needed resources that aren't always available when you start calling the list of providers on the insurance network. So once you find a provider that you really like and you connect with and that has the methodology that you want to be utilized, there's an option to get a single case agreement or an ad hoc arrangement and to really push and advocate with the insurance companies to authorize that. And then the provider needs to be willing to jump through some hoops, like negotiate a contract specific for that person. It's kind of like in the regional center, a client-specific vendorization. So I've also done those, and I know providers that can do some of that too. But it takes a little bit of hoop jumping and advocacy. But it's easier. I found it's easier with the insurance companies to do that advocacy. The regional center is a little bit more reluctant to do that.
Okay. Thank you so much.
Great.
Anything else?
No, that's a very articulate way to describe that you have benefits through your insurance that you can maximize if you know this little secret, if you know the right lingo, that's your ticket in.
Okay. Thank you.